Dr. Ryan Tischauer, and today we're going to be talking about something that is very dear to my personal practice, and that is medication elimination and a lot of the dangers of very commonly used medications that people feel are very safe, which current research is showing that they are not. Now, there are times, obviously, when it is very important to be taking medications, and that needs to be determined by your holistic practitioner. And like I said, there are times when it isn't critical to be taking them, and when it's important. But a lot of times, people are just popping these pills like candy, and they don't realize how dangerous they can be. So I want to talk to you about some of the current research articles that I talked with people about in my practice, and I let them know about these things. Now, first I want to start off with is from the Journal of Infectious Disease, and it states that people who take aspirin and Tylenol, they decrease their body's ability to produce antibodies to destroy the cold virus. So it decreases your immune system. Low-dose aspirin produced virtually no benefit and actually increased the risk of major hemorrhages, ulcers, anemia, and risk of fatal intracranial adverse events. And that's from the Journal of the American Medical Association. So a lot of people are taking this low-dose aspirin for their heart, and it's very dangerous. Cholesterol-lowering medications actually decrease your helper T cells, which is another immune system cell, and that's from natural medicine out of Switzerland. So that's like statins, which is a very common medication today. According to Dr. Greg C. Fonarow of UCLA, professor in cardiovascular medicine, 75% of all heart attack patients have normal to low cholesterol. So it's kind of a myth that that's the cause of a lot of these things. Actually, we see that it's a big part from inflammation. Now, non-steroidal anti-inflammatory drugs like ibuprofen and Motrin, they cause more than 10% increase in congestive heart failure. That is from the Archives of Internal Medicine. Next, 80,000 women ages 31 to 50 who started off with no high blood pressure, non-hypertensive, and they were using non-steroidal anti-inflammatories 2 times per month. Their risk of having high blood pressure went up by 86%, and that's again from the Archives of Internal Medicine. Antibiotic use increases the risk of non-Hodgkin's lymphoma, which is a type of blood cancer, and especially those who were given antibiotics more than 10 times as children. That's from the American Journal of Epidemiology. Non-steroidal anti-inflammatory use increases... Oh, I'm sorry, I said that one already. According to the Center for Disease Control, the CDC, Tylenol is actually the deadliest drug in America. It is actually one of the #1 causes of liver disease. Aspirin is the leading cause of kidney disease and one of the leading causes of stroke, and daily use is associated with pancreatic cancer in women, and that's from the American Association of Cancer Research. Next, acetaminophen, Tylenol, is linked to chronic obstructive pulmonary disease, which is asthma is a type of that, and decreased lung functioning. That's from the American Journal of Respiratory and Critical Care Medicine. The Canadian Medical Association reviewed 20 studies over a period of 30 years, which showed that the pneumonia vaccine was virtually 0% effective. And the last one I want to share with you today is that the American Academy of Pediatrics no longer recommends antibiotics for ear infections, quote unquote, as almost 93% of ear infections are in fact only effusions, which is a buildup of fluid, and they are completely sterile. So there's actually no infection there. Now, we can be contacted again. I'll leave our contact information there, and hopefully everyone finds this video and they're doing well. And hopefully we will speak with you in good circumstances. All the best to you, and have a good day.